Man, I got a package. We're going to open this package in real time. All right, get everything pulled up here. See who's popping in here. Oh, it's shaking. Why is it shaking? I love this song. Thank you, Christopher, from the Blakery Content. Good morning, Amanda Donnell. Welcome in. You must be waiting for the shuttle to get to work. Christy Wendy drove up to Falls Church. Oh, that's in Virginia. For an appointment yesterday, driving in DC is, oh gosh. Amanda, thank you for the level up sparks. Oh, level 17. Dang, girl. You're one of the OGs. Been here since the beginning. And the Daily Heartmate. Oh, I'm honored. I'm so honored. Yvonne Stander. Hello there from South Africa. Wow. I think that's the first South African we've had pop in here. Thank you for stopping in. Appreciate you. My name's Gary. I'm an ER nurse in the United States on the East Coast of the U.S. And I live stream every weekday morning where we talk about nursing, mostly nursing, but we talk about other things as well. The Starfire Power, hello from Texas. Welcome in. Thank you for the follow. I appreciate that. Laura Renee, good morning. Welcome in. Good to see you again. Let's see here. Hopefully all of our audio issues are corrected today. One of my favorite songs is back on all the streaming platforms. Affirmation Club put their song back on there. So we did some live streams yesterday, 2 of them outside of my normal morning drive time. And it was incredible. Just great questions, just nonstop questions. They go so fast, lots of wonderful questions, learn some new things. Freya, thank you so much. To all the first responders out there, I am an EMT. I've been an EMT for a while. I just want to thank you all. It's EMS week, so thank you all so much. And I appreciate all the work that you all do. Oh, Mr. Clean's in the house. You know what that means. First, we got to get to Amanda now that song's over. Oh, Amanda Donnell is an LPN, and she is working towards her RN, and nursing school has her, everything's on fire, but it's fine. Mr. Clean, welcome in. We'll get to your song here in just a second. Are you sure? Are you sure? And then there's Mr. Clean. Thoughts on VSG? What's VSG? I listened to this when I did 2.5 hours of yard work yesterday, like my playlist. And that's how I knew that my favorite song was back. Well, my current favorite song. You know, you get that song that you really like. It's Unbothered. It's called Unbothered by Affirmation Club. The artist took it down for a few days. I'm not sure what the reason was for that. I think there were some copyright issues. Somebody else had tried to take that song and claim it as their own, is what I remember reading. But she actually replied to a comment I left on her post, and she said it'll be back in a few days, and it came back yesterday. So I was very excited about that. So welcome in. If you're joining us over on the Gram or the Stack or the Tube or the Book, we appreciate you stopping in. We're going to do some bonus lives today. So just keep an eye out for that. I don't know what time those are going to happen, but I do have some other chores I got to do. I've got the minivan came home yesterday from tennis practice with a flat tire, like flat tire. Like I can't find the hole, but either I'm going to try and fix it, or I'm going to have to take it to the dealer, or not the dealer, our mechanic, which I'll probably just take it up there because my truck's up there getting some routine maintenance, tire rotation, and state inspection. So I might just swap them out, leave the van up there and tell them to fix the tire, because we got our tires from there. And so that comes with that patching for free. Holly, good morning. Oh, we got Holly in the house. Oh, I'm not backwards on purpose. I just forgot to flip the screen. You got to go into the settings after you go live. And I forget to do that sometimes. But thank you for letting me know. See, now it's William and Mary. Try pride. Try pride. Thank you for the daily heart me. Welcome in, Holly. Let's see. Oh, somebody said it was a sleeve, a gastric sleeve. What are my thoughts on that? I don't know. I think if it's right for you, I think that's the good option. Time falls. May I ask a question? Go for it. Taz Girl, thanks for the follow. Appreciate that. Let's see. Goddess this week has had a full moon energy without the full moon. Ooh, that's not good. Thankfully, it's my short week. So I'm off most this week. I only work tomorrow and Thursday, and that's it. Dr. Rob Kelly, good morning. Thank you for stopping in. Where are you based? Not like specifically like region. I'm on the East Coast, Mid-Atlantic in Virginia. Goddess has been a clerk in the ED for 21 years. Oh, I bet you've seen and heard many things. You could write a book on that. A little Harvey Danger on this Wednesday. What is it, Tuesday? It's Tuesday. Oh, it's going to be 91 today. I'm glad I got the yard work done yesterday because yesterday was hot and today's just going to be even hotter. All right. Let's get a few more of the regulars in here. Let's see if Ames pops in. But I have a package that has arrived and we're going to open it today. Scotty B in Hampton Roads, welcome in. I used to live out there, the Hampton Roads area. One of my best friends still lives out there. We go to visit them and go to Busch Gardens from time to time. Diana Gaudreau, the ER is the Wild West. Yes, that's how I describe it. It's the Wild West. And ER nurses are feral old chaos gremlins. That's how I describe ER nurses. Scotty B, Chesapeake. Yep. I used to be a big fan of the Hampton Roads Admirals. I think they're the Norfolk Admirals now. But I was there for game one, their very first ever game in like 1989. I still have my Admirals jersey up in my closet. I had it customized. I'm old. I had it customized with my name. And now after 36 years, because I've had that since 89, like 36 years, that's finally starting to come off. Oh, Bobby's in the house. Oh, we got to get the Bobby going. Got to pull it up. Got to find it. Good morning, Bobby from Boston. Welcome in. It's going to be hot today. 91 here. I can only imagine what Boston's going to be like. Little Dropkick Murphys. Got California. Oh, it's early for you. Like really early for you. What is this? Zoocosis? Xavier is BSN RN students in Houston, Texas. Oh, we want to talk about hot. I've been to Houston in the summertime. Unbearably hot. I don't know how y'all survive out there. Alexis, I have a fear of failure. How long did it take for you to get comfortable? I get that question a lot. So I'd say I was about 3 years into my career. My first year was spent in a medical surgical ICU, and then I've been in the ER ever since. So I think it probably took me about 3 years to feel really comfortable as an RN. Now, I think it's probably a little different for everybody. Do nurses eat their young? Yes, there are some nurses out there that are mean and that like are mean to new grads on purpose. I wanted to get to this question on zoocosis. I'm not familiar with this. So I got to find a reputable source, which I'm not seeing a whole lot of it. Here we go, Merriam-Webster. We'll look at this. Specifically, an abnormal condition of captive animals that is characterized by repetitive, sometimes self-destructive behaviors such as pacing, over-grooming, and is held to be caused by the stress of captivity. Oh, gotcha. So I'm not familiar. I just learned that today. So I don't know much about that. P. Walker 35, thanks for the follow. I appreciate that. It's going to be 95 in Boston. Oh my gosh. That is really hot. Anything over 85 is unbearably hot to me. That's just me. Oh, Goddess just got off work out in California. Got off at like 3 a.m. Or yeah, that's weird. That's a weird time. The Cypress, am I the only one that smells cigarette smoke in the Gary studio? No, I smell it too sometimes. And I don't smoke. I don't understand that. Why do nurses eat their young? I don't know. I don't understand that at all. Like, I love new grads. I love precepting. I love teaching. That's why I'm a clinical instructor. I mean, I really enjoy it because I had instructors who were not nice, and I had nurses who were not nice when I was a student, and I don't want students to have that experience. Nursing can be a wonderful career, and I think if you have the right folks to kind of guide you along, hopefully I'm one of those. I try to be, I aspire to be. Is neuroplasticity real? I believe it is. I mean, it's something I'm familiar. I don't deal with it on a regular basis, but I mean, it is a thing. I don't know. Like, are we questioning that? Neuroplasticity is the brain's lifelong ability to form, reorganize, and strengthen synaptic connections in response to learning, experience, or injury. Rather than being a fixed, hardwired organ, your brain is highly adaptable, constantly rewiring itself to help you acquire new skills, recover from trauma, and adapt to changing environments. Yes, neuroplasticity is a real thing. Love it. Oh, we got someone in public chat. Oh. Legal Nurse Leads, good morning, Jen. Let's see, where do we got you? Here we go. Y'all like that, didn't you? Ciao. It has really grown on me. Love it. Love it. Thank you. I've got the hair toss down. So I actually have mastered the hair toss because for whatever reason, I don't know, like I'm not like manly man, but I feel like I'm solidly in the male category, right? Like there's very little confusion. Yet I still get called ma'am all the time. And so when somebody says, like, I'll say, let me know if you need anything, they'll be like, yes, ma'am. And I'll look at them and go, it's the hair. And I'll flip my hair. And most of the time it cracks them up. Sometimes they just look at me like, what is wrong with you? So I'm digging the positivity vibes that we got from like Lizzo, very positive. Affirmation Club, unbothered. Like I'm loving this vibe, right? Kimberly Barbaro, how do I help a really horrible migraine? Got a brainstem aura right now, and it's bad. Can't even form words. Usually, people with migraines have some type of like plan or medications that they can take when they have this happen. If you don't, then I suggest you get in touch with your neurologist. The migraine right now being as bad, the ER can treat that. So if you have the means to get there safely, you can certainly go there, or even like an urgent care. A lot of times, urgent cares, when I say urgent care, there's like MedExpress or Minute Clinics. I think, some of those have where they can actually, do medication. They can start IVs, they can give fluids, they can do that kind of stuff. So, and it depends on the treatment. Like there are migraine cocktails, magnesium sulfate is one of those that they can do. That can help. It depends on the provider. It depends on what works for you. So I think, I think being evaluated by a physician, if you're having a migraine that is you can't control, and the things that you normally do aren't working, might be worth going there. Chester the Cheeto, should I go to the ER for my embedded piercing in my skin? I don't know. I don't know if that's necessarily a medical emergency. I might try visiting your primary care doctor or an urgent care. It depends. If it's infected, if there's concern over infection, yeah, you might need to go to the ER. Why do lungs keep filling with mucus and how to clear it? You could be like, it could be allergies, but when you say your lungs are filling with mucus, you should probably go see a doctor about that. That's not a normal presentation. What does it mean when your lymphocytes are high? Lymphocytopenia, it could be a few things. Let's take a look at the differentials here. All right, so lymphocytosis typically means your immune system is actively working to fight off an infection, recover from illness, or respond to inflammation. So it could be you have an infection. It could be that your body is trying to fight off some type of inflammation, maybe autoimmune. Hard to say. So I'm guessing you've had blood work. And go to the Mayo Clinic. Mayo Clinic's a really good reference. So the list is very long of things that could cause this. It could be ALL, which is acute lymphocytic leukemia. There's a bunch in here I can't even pronounce. Brucellosis, cat scratch disease, CLL, Hep A, Hep B, Hep C, hypothyroidism can cause it, lymphoma, mono can cause it, severe medical stress, such as some form of trauma, smoking, splenectomy, syphilis. I mean, there's like, the list goes on. There are so many things that could cause it, but you need to see a doctor, which sounds like you already have. How can I apply to my hospital? I work for the federal government. You'd have to go to USA Jobs and create an account and look for open positions. Why are people treated so poorly when they come to ER for pain? Amy, that's a good question. And I think I would tend to agree with you that I think pain is undertreated in the emergency department. I think it kind of stems back to this whole opioid epidemic. People are, doctors are afraid to overprescribe. They're afraid of legal repercussions. And I think there are some people, they're afraid of feeding into like a possible addiction. So yeah. Daphne, I have no way of knowing. That's what a doctor does that. I'm a rando ER nurse on the internet. Allegedly. I tell you I'm an ER nurse. Bobby asks, are you seeing a lot? Oh gosh, yes. Yes. I feel like every day we get people that come into the ER for tick bites. Look, no one's judging. We're listening to some NSYNC. It's in there. Just deal with it. You're just going to roll with it. Great Lakes. I live in an ambulance. I have a buddy I used to run rescue with. He bought an old ambulance and he like basically lives out of it. He like retrofitted it into like basically a camper. Mr. Clean says I'm a random clean nurse. Allegedly. We just got to take your word for it, right? Oh, that's what you did too? Oh, that's so cool. Yeah, man. Like he wired it with all the electrical stuff. Yeah. He bought like an old one at like an auction, a government auction or something. Dan's RN. I'm an ER nurse also, but in the Philippines. Okay. That's we had somebody from the Philippines during the live yesterday that stopped in. Packer fan. Never thought I could like a Packer fan, but here we are. I'm a Bears fan. Allegedly. So legal nurse, I used to work I was as a journalist for a long time. So you had to be very careful with how you worded things. And allegedly, and that's why they always say, the alleged assault occurred. And like, we literally have video. Like, why is it alleged? Because legally it is. Before it's adjudicated, you can't say that they did it. You say allegedly they did it. Kiki's mom, welcome in. Alyssa, I was a CNA for years. I work at a gas station for peace. Had to slow down. Hey, I'm a strong advocate for managing your peace. All right, shall we? All right, let's see what came in this package. I know what it is. You don't know what it is. We debuted the Gastro Ginger PA or the Med Sheeran mug yesterday. Got some weird looks from my wife. She was like, reading it. It says poop is gross. So I'm still going to look. And she looked at me and she was like, okay. It's a Speedo. No. Although they do make bicycle Speedos. I would wear that, but I'm not wearing the thong Speedo. Oh man, look at this. Oh, it even says thank you. Oh, I hope you can untie this, because if I have to cut this, well, it's flexible. We're just going to pull it to the side here. Yeah, pull it to the side. Oh, man, look at that. The Violet Stitch. That's who I got it from. Oh, yeah. There it is. Oh, we got to put it on. All right, let's put it on. Oh, look at that. Huh? Oh, looks great. I love it. It has the ears. Now, she would literally, she'll make any colors you want. And I just went with the default, like the black bear. Now, it's summertime. I will not be able to wear this for very long. But in the wintertime, in this room, it gets pretty chilly. I'll sometimes wear a hoodie. But yeah, in the wintertime, this is going to be great. And it is thick. Like, this feels like Carhartt thick. It's not like, I don't know. It looks really good. I'm really happy with it. So I'll have to leave a 5-star review on Etsy. Yeah, it's got ears. I should have changed the gifts to the bear ears. Let's see. I have permanent blind spots now. Thanks, ER. Oh no, what happened? What did we do? Oh, a lupus patient then sent home from the ER for a full year. Turns out to be HCQ toxicity. I am not familiar with that. To the Google machine we go. HCG toxicity. See, I learned something new like every live I do. All right. Human chorionic gonadotropin toxicity primarily refers to the adverse effects from high-dose fertility treatments or dangerous weight loss fads. It can trigger ovarian hyperstimulation syndrome, or OHSS, in women. It can cause life-threatening abdominal pain, rapid weight gain, and severe nausea. Additionally, non-prescription HCG diet programs are considered dangerous and ineffective. So I'm going to have to add that to the list, which we will do now. Which, by the way, if you go to my link tree, you can find a bunch of links, including the things that we learn during the lives. I call it the Livestream Learning Library. Alliteration. Woo! You can go there and look at it for free. That's like just a repository of information that we gain when we do these lives. And when I say we, I mean like the royal we. And I do everything in alphabetical order. All right. So I like to go and I try to do alphabetical order. So this would be under H. There we go. And what I'll do is in the short term, I just add the title, and then I'll go back in and do a summary on it later. And I do date of live stream, which is today. So you can have some kind of reference like, oh, when did we talk about that? I need to figure out a way to like be able to categorize this so you can search by name or date. Because like, oh, we did that on the 19th. May 19th, 2026. Ooh, gosh, it's going to be June soon. Holy smokes. Styling, that's right, styling. So like it used to be when you have like right now you see like Gary next to your name. It used to be Gary, like Gary's Bear, like Bears. Because my nickname's Gary Bear. Hence the hat. That's why we have Gary Bear the hat. Susie Moo, good morning. This is the Noonie. Oh, welcome up. Welcome in, the Noonie. I remember the Noonie. You changed your name. Penny 420. Why would a lupus patient be on fertility treatments? Really are an ER nurse. Oh, we getting a little testy? HCQ. Well, you know, Penny, if you don't like what you hear, you feel free to swipe on up. HCQ. Okay, I read it wrong. Oh, excuse me. That is not something I see in the emergency department. Not at my emergency department. Hydroxychloroquine toxicities, serious dose-dependent adverse, primarily linked to the long-term use of medication. There you go. All right, it's getting hot. I got to take this thing off. Yeah. So you know what, Penny? You know, it's early in the morning. I don't mind, but you know, like any other comments that are coming across like that, then you can be done. Oh, look, Holly already got to you. Bye. Like, just scroll on. I'm like trying to answer questions and learn things. Young cheapie, ignore the toxicity. Oh yeah, we're not doing toxicity here. No. Like, I'm happy to look up new things. I'm not going to sit here and tell you I know the answer to everything, because I don't. I deal in emergencies. And that sounds like it was a long-term issue on a chronic medication. Gary, I have 7 chronic illnesses and I watch you go to sleep because you remind me of good health. Oh, well, good. I'm glad. I'm trying to be positive here and I'm trying to learn. Like people come in here with all kinds of new things and I'm like, oh, I've never heard of that. Nigel, I'm going to finish school soon. Congratulations. What's going to be my biggest shock in the ER? I'd say how quickly things can go from 0 to 100. You know, it can be everything looks like everything's going cool, and then all of a sudden it's not. And like you get something that walks through the door or an ambulance that rolls in, and man, you're just like, oh, okay, time to change gears. Have you heard of PNSE? Yes, that is vaguely familiar, so we'll go check it out. Persistent non-symbolic experience. So I'm not as familiar with it as I thought I was. Is a term in cognitive psychology used to describe various persistent states of self-transcendence, awakening, or enlightenment. Yeah, I'm not familiar with that. So I must be thinking of something else. Got diagnosed with GBS, but one marker doesn't match. What else could it be? I don't know. Like that is beyond my scope of expertise. Like I'm an emergency department nurse. I deal with critical values in like heart attacks, like MIs, strokes, PEs. Those are the things that I deal with. That's right. A good nurse, like I tell my nursing students, I tell them, look, this is just the beginning of your education. Like once you graduate, you're not done. In fact, you're going to learn more as a nurse than you did in nursing school because you will likely be a nurse for longer. And the education never stops. And there's going to be a lot of things that you learn and then you don't use in your particular field. For example, all the things that I learned for dialysis, I don't deal with dialysis in the ER. I deal with patients who come from dialysis, but I used to be able to set up an entire dialysis unit. Like I could cannulate them, I could set up the machine, do all the fluids, calibrate it, all that kind of stuff. I couldn't do that today. I'd have to relearn that all over again. If I go to the ICU, if I had to go to the ICU, I'd have to relearn all of that again. Most of it. There's some things I can still do. Amanda, an ER nurse helped save my husband's life. Endocarditis, but no one could figure it out but the nurse. Oh, wow. Well, I'm glad there was a nurse there to help figure that out. My gastroparesis was told there is nothing they can do for it. Like the ER said there's nothing they can do for it. Oh, Ames is in the house. Welcome in, Ames. Now I got to show Ames the hat, right? Because she came in a little bit later. She slept in this morning. Susie Moo, how was your nurse's week? Did you feel appreciated? It was all right. It was okay. Yes, Ames. We got the new hat. Here we go. What do you think? I had gastroparesis like one time, and I think I ended up just going home. I don't think they gave me anything. Oh, it's too hot, Ames. I gotta take it off. It'll be great in the wintertime, but that is thick. I mean, that is thick. And allegedly it's custom made. Let's see. Oh, there it is. Yeah. That was awesome. Ames, thanks for the woolly hat. That was the inspiration for getting this. And plus, my nickname's Gare Bear, so allegedly, Mr. Clean, allegedly. What's a call you responded to where you had to try not to laugh because of how silly it was? Common cold. I mean, there's no way for us to know, but like got there and was like, yeah, I didn't have a ride. What? yeah, and I think it was like the symptoms are just like this sounds like a cold. Are you having a fever? No. Okay, I just want to go get checked out. And you called 911 for that. Yeah. Okay. Am I a day walker or night crawler? What do you call a mid shifter? Because I'm a mid shifter. So I guess probably day walker. I don't like getting up super early to go to work. If I'm getting up to do the live or something I want to do, I'm okay with that, but I don't like getting up to go to work. Mid shift is much better for me because usually where I work, it's a little more chill at like 9 o'clock at night. So I can kind of wind down before I head home. Not always. Sometimes, we get the MIs or the strokes that walk in like right at 9:30 and then it's go, go, go right until I have to leave. And sometimes I got to stay over. Oh, look, Ames. So nice we had to play it twice. This is just where it came up in the playlist rotation. Ryan, I was on ADHD medication, which boosted my blood pressure. Oh my gosh. Are you symptomatic? That's the real question. Symptomatic, that bottom number, the diastolic being that high is concerning. So I would definitely get evaluated. If you have a primary care, I'd call them and start there. Oh, Deirdre. Deirdre? Thank you very much. I appreciate the daily heart meme. Like the top number 168, we wouldn't really do anything about that in the emergency department. The bottom number being that high is definitely a little concerning. Deirdre. Okay, it's Deirdre. Thank you. Appreciate that. Try to make an effort to get people's names right. You got to give me time to let my brain do the neuroplasticity thing and learn. So I did 2 lives yesterday, and each one was awesome. Like so many comments. Like both of them had over 3,000 viewers and got like 100 new followers out of each of them. It was wild. And I just did them from my deck, like upstairs on my screened-in deck, just sitting them there, like no walk-up songs. I did sing. Whose walk-up song did I sing? I did Mr. Clean a little bit. I think I did Ames, came in like a wrecking ball. Like, not, I mean, don't get excited. Angie's from Australia. G'day, mate. Does menopause cause tiredness? I would imagine. I don't know. I think it certainly can. It can cause a lot of other things too. Michelle K, good morning. Welcome in. Michelle, I have shared out the site that you sent me with a lot of folks that I work with, and they're interested. So hopefully we'll send some folks his way. I'm good. I've been off. I was off yesterday. I'm off today. We're expecting some pretty nasty, whatever thunderstorms are rolling through right now, the Midwest. I think we're going to see some of that today. Definitely tomorrow. If I sang on a live, I would get banned. Is that what you meant saying? Get banned. What stet are you using? What does that mean? What stet are you using, nurse? That seems weird. The way that's phrased, like a threat. What stet are you using, nurse? Oh, stethoscope? Oh, thank you. Apparently, I've not had enough coffee. So I actually have an Echo 500. I have some hearing loss, and that helps me hear better. And it actually gives me a 2-lead rhythm strip as well. Before that, I used a Littman cardiology one, but now I have the Echo, which I absolutely love. And the only reason I got that, because it's very expensive. The only reason I got that, El Massey's in the house. Yes, I get to play my song, and it's back on the streaming services. Good morning. I love this song. I was doing yard work and I had my playlist on, and this came back on the playlist. So they put it back in automatically. And so I was very excited. CO here. Anytime we take a guy to the hospital, you guys make my shift. You guys are twisted. Yes, ER nurses, feral chaos gremlins, as I call them. Yeah, we're a different breed. Yeah, dark sense of humor. I don't know if ICU nurses have the same dark sense of humor as ER nurses do, because we're pretty twisted. Thank goodness I blare it before going. I know, right? That's what I told the artist. I left a comment and I was like, this is my like pre-work hype song. I need this. And she was like, it's still on YouTube. You can go watch it on YouTube. Oh, you think ICU nurses do ER and ICU? Okay. Yeah, because I haven't been an ICU nurse for a long time and I was a new grad. So I was just trying to survive, stay afloat, keep my head above water. But wait, no, they're boring. Everyone's boring down there. ER nurses make us blush. What's the name of my song? Like for my live? It doesn't really have a name. It's like a file name. But you can find it on, I have a SoundCloud and it's there. I'm Gary the ER nurse, literally everywhere. Anywhere there's a platform, I'm probably there. Music Junkie, welcome in. Good morning. JHEG. How do you pronounce your name? Sup, dude? Filipino MLS here. Welcome in. Thanks for stopping in. We're getting a larger Filipino crowd in here. No, the one you just played. Oh, that's called Affirmation Club. The band, not the band. The artist goes by Affirmation Club. The name of the song is Unbothered. And it should be back on. It should be back on all the platforms. She had to take it down for a few days for some reason, but it's back up. Deidre, you have to have a twisted sense of humor to work as an ER nurse. As a nurse, I don't know if you have to have one or if you develop one. I don't know. I worked EMS prior to this, so I may have already had one before I went to the ER or went into nursing. Oh man, so we've got a fancy coffee maker. You certainly developed one, I agree. That's a coping mechanism, I'm sure. So during COVID, we invested in like a fancier coffee maker, right? It can do cappuccinos, lattes, all that kind of stuff automatically. G, like G. People from the US call me Mark. Well, if it's G, I'll call you G. I mean, I want to call you by what you prefer to be called. Yes to my PTSD. It's given me yes. I developed one to deal with the corporation. Oh gosh, yes. This is Bell. Anyone send help? I'm currently first-year college student and struggling financially, can't afford. Oh, I'm sorry to hear that. That is, yeah, it's tough times to be a student, especially if you don't have, like a good support network. Hunger Strike, yes. Temple of the Dog. What a great collaboration that was between Pearl Jam and Soundgarden. And have Eddie Vedder and Chris Cornell singing vocals on the same track is just chef's kiss. G says here in the Philippines, ER and lab are always at each other's necks. There's definitely some animosity between the two. What happens here is our blood samples that we send upstairs to the lab, they'll call us and say it's hemolyzed. And the ER nurses are like, there's no way it's hemolyzed. Like that was a clean draw. Like there's no reason that should be hemolyzed. So yeah, yeah. But you know, I've learned because I've talked to some lab techs who I've befriended over the years, and I've said, hey, look, it's like we need to bridge the gap here. What are we doing wrong? And so they've given me all kinds of tips and tricks, you know, to try and mitigate that. Sometimes it pulls too hard. You know, there's a lot of things that can cause it. But I did have one admit, like we had one in the live who actually said, hey, sometimes it's our fault. We just might not tell you. Like they left it too long or they did something wrong and then, but they don't tell us. But one was like, yeah, I usually tell them like, hey, I forgot to do this. Bobby's heading to work. Bobby, have a great day. Stay cool. It's going to be 95 in Boston today. Holy smokes. Status critical. I got an IV yesterday and it hurt so bad. I read that and I was like, oh, yes, you got an IV. I thought you started the IV, but you actually got an IV. And that's what hurt so bad. Oh, I'm so sorry. King Roma, what's going on, man? Haven't seen you in a while. I hope you're good, brother. Oh, Jimmy Eat World. Absolutely love Jimmy Eat World. So this album debuted in 2001, like late summer. And then, of course, September 11th happened. The name of the album initially was Bleed American. And when September 11th happened, the band changed the name of it when they didn't think that was appropriate given everything that was going on. So they changed it to just, I think, Jimmy Eat World. I think, and then years later, they kind of like reverted back to the original title. Anyway, just some random music knowledge for you. King Roma's doing great. BSN program currently. I'm doing good, man. That's great. How far along into the program are you? And how's it going? A lot of work. Michelle K, I worked in the lab for a short time, and yes, sometimes it's difficult, right? But where I work, the lab has never owned that. If they've made a mistake, they've never told us. They're just like, we need to redraw on your lavender, please. Oh, okay. The Megan Marshall, welcome in. A lot of work, 7 months to go. So what, by the end of the year then, roughly? Gee, well, as a text, sometimes we forget to refrigerate it. Yes, that's what I was told. Oh man, so yeah. What was there was an article, there's a couple of things I wanted to talk about today. One, happy EMS week to all the EMTs and first responders out there. And then I did want to talk about, I saw the Supreme Court, which is always kind of a loaded topic as soon as you say that. But they did decline, well, I guess it would be, they temporarily blocked an appeals court ruling that would have restricted the availability of mifepristone or mifepristone. This allows it to continue to be prescribed via telehealth and mailed to patients while the legal challenges play out in the lower court. So small victory for women's health at this time. I know there's going to be people that disagree with that, but if you've been on this page long enough or you followed me for long enough, then you'll know where I stand. And just want to big thanks to everybody, especially the regular crew, the ones who have the walk-up songs that are here supporting me every single day. Mr. Clean, Ames, El Massey, Bobby, Holly, Amanda, Legal Nurse Leads. Y'all are great. That is why you guys are, all have your own walk-up songs. It's just my way of saying thank you. But we are slowly growing a really solid group and of like-minded people. So we are pushing 40,000 here on TikTok, which is just mind-blowing, and that's incredible. So last time I checked, we're at 39,300. So we're making that push to 40,000. We're 22,000 over on the book. We're at 5,000 on the gram. So yes, the numbers are growing each and every day. So I'm grateful for that. And the more we do this, the more I learn. So it's like an education for me. Nelson, thank you very much for the daily heart me. I appreciate that. What does it take to get a walk-up song? Well, so the people that have walk-up songs have been with me for like a long time, like sometimes like a year. They have been here supporting me, sharing out the live, showing up every day to support me. So yeah, and a lot of these people I talk with offline too. Nelson, nice to meet you. One of my best friends is named Nelson. Gee, my aunt is a head nurse in Orange County. To be honest, I want to go get my ASCP cert to work there too. That's great. Ames says $20,000 donation made payable to Ames. My walk-up song is just you saying the Megan Marshall. There you go. I love it. Oh, Goo Goo Dolls. I love the Goo Goo Dolls. Bobby's back. Got you on in the truck. Oh, that's awesome. So I have found that there was a time when I could not listen to other people's lives on my phone on TikTok unless the app was actively open. But I've found that now it will play even when I like accidentally turn it off. I can still listen to it. So I don't know if they changed something. Urinal Puck. That's an interesting name. Should I ask to have my file changed? Found out extreme discs in neck 3 times levels. They think anxiety. Oh, so they initially put anxiety as a diagnosis, and then you found out later that it was a medical issue. You can request it. Yes, I don't think a lot of people know that they can request a change if there's a correction. You can request that it be made. I'm not sure what all goes into that. Like if there's a review process that they have to make sure that that is actually true. So I don't know. I'm sure there's some subjectivity to that. Lisa, QQ, how often do you use microbiology in your everyday skills? So on the surface, when you look at microbiology, probably not, but it's kind of like geometry. Like you don't think you use geometry every day, but in a way you do. So when you're going somewhere, you know that if there is so think of it like a triangle, right? So if you could keep going straight and then make a turn to get to a point, but you know that you could take a diagonal path straight to there, that's geometry. The quickest distance between 2 points is a straight line. No need to go all the way up, turn left. So you use that on a daily basis. You just don't think about it. So microbiology, I would say, is the same thing. You don't think about microbiology in the sense that we learned it, but I think you retain some of that, and then you apply it to some of the things that you do as a nurse. Bobby says connected to Bluetooth. In Bluetooth, I think Bluetooth has something to do with like a Viking god, isn't it? I feel like that's what it's named after because it was invented by like a Scandinavian country. Let's see. Bluetooth was named after the 10th century Viking king Harald Bluetooth Gormson, who famously united Scandinavia. Intel engineer Jim Cardack suggested it as a temporary placeholder in 1997 as the technology was designed to unite different communication devices, PCs, cellular accessories, just as the king united Norway and Denmark. So it wasn't a god, it was a king. There you go. I had some recall on that. Bobby says, I feel like a goddess. Good, as you should. You should. Throw your hair back. Check your nails. Baby, how you feeling? Smarty Pants Nurse, good morning. Gary prepping for Jeopardy. Right. I'm so much useless random knowledge in this, cranial vault here. In a hospital, as long as there's pathogens, they'll use microbiology. Have you ever heard the song Low? Yes, absolutely I have. Mine still plays when I cut it off too. Oh, that's cool. Yeah, so I think that's something different because it didn't used to be that way. When I would accidentally turn it off, it would shut everything down. I couldn't hear anything. So I wonder if they changed that. I like pretty much anything Goo Goo Dolls. And they're still making good music. I mean, for 60, he looks pretty good. Now he's had a lot of work done, but I mean, he keeps in good shape. He still sounds really good. G, nice to meet you. Thank you for stopping in. I appreciate you. Thank you for the follow. Bobby says on fleek. Is that still a word? You're showing your age, right? That's not still a thing, right? In the 90s, on fleek? No, that was way after the 90s, I feel like. That was like mid 2000s. Like 2000, I don't know, late 2000s maybe? 2009. No, I definitely never said that when I was in school. What's your advice to a new grad RN their first week in the med surge or the ER? I think probably the too long didn't read version is trust but verify. When you're a new grad, you're going to get a lot of information from a lot of different sources. You're going to get respiratory therapy, residents, med students, doctors, all kinds of sources of information are going to be feeding into your brain that is going to try to absorb all of this. Trust that information, but you should verify it. Don't just take something they say at face value and incorporate that into part of your educational process with your patients. Verify that first. And Ari says, yes, give yourself grace and understand it's going to take years for you to feel comfortable as a new grad. Bobby says I'm 50. I can't remember. I'm 51. I definitely can't remember. I mean, on a daily basis, I will go downstairs or go upstairs. I will walk into a room and literally stand there like, what the hell did I come in here for? I know I'm not alone. I know a lot of you do the same thing. Do you know much about thyroid problems? To some degree. My wife had Graves' disease and had a total thyroidectomy. And they were able to keep the parathyroid glands intact and did not have to relocate them. In some cases, they could relocate them to like the armpits, which is wild to me. Oh, Bobby's got a birthday coming up, 51 this Saturday. Oh, so you're only like 5 months younger than me. Oh, so you're a 1975 baby. Nice. Like we are right there. Oh my God. Yes, I need a thyroidectomy. Oh, okay. Yes. So it ended up, I mean, it was the right decision for us. Like there are different ways to do that. There was the option of doing a thyroidectomy. There was also the, the implant with the, like, was it iodine? Is that what it is, Ames? They do like an iodine something or other. I gotta look that up now. Is that what it was? Oh no, it's the radioactive iodine or RAI therapy. I was on the right track. It is an internal nuclear medicine treatment where you swallow a pill or liquid or receive an injection. The radioactive iodine travels through your bloodstream and is absorbed by your thyroid cells. The radiation then destroys the diseased, overactive, or cancerous thyroid tissue without heavily affecting the rest of your body. The problem with that is, like, you can't use the same bathroom or utensils or cups or stuff like that. You can't use the same things that your partner uses. And the other thing is, the reason my wife chose not to do that is because we wanted to start a family, and the timing on that would have been a lot different if she chose the RAI therapy. So ended up going with the total thyroidectomy. But that's a personal decision, and that is totally up to you in the conversation you have with your doctor. Is nursing really difficult? Yes, it can be. But it's also very rewarding. And that's why so many of us stay in it despite all of the trauma that we deal with on a daily basis. Ames, thyroid needs iodine to survive, so we use radioactive iodine like a Trojan horse. Sneaky. Oh, come on in. Ah! I hope that shows up in the highlights. Because thyroid is to do with autoimmune condition, right? And stress can trigger the levels. Yeah, that makes sense. I'm not as well versed in that. Smarty Pants says R131. That must be the one we're talking about, the RAI therapy. The trauma is worth it. I like helping. Oh, the Dragon Crown, Ames. Look at you. I love the Dragon Crown. That is so cool. And then I get to watch the replay on the laptop. That's awesome. Ames, I keep checking my email. It's getting like close to the end of May. I've not heard from CEN yet. As soon as I hear something, I will definitely text you. I don't know what your username is. It's just a symbol. I'm incoming first year. What can you advise? What can you advise me? Like a first year nursing student, I would say focus on your studies. Put your social life on the back burner, and really, nursing schools and nursing programs are very challenging and they are unforgiving. You make a mistake, and like most of the time, programs you can fail one class. If you fail two, and failing is less than a B. C is not a passing grade in nursing school, at least most of the nursing schools I'm familiar with. So you got to really focus and dig deep and focus on your studies. Music Junkie says yes, focus on school, buckle down, find a fun study group. I would say find a good study group. Fun is a bonus, but if you're having too much fun, you may not be learning as much. But I mean, you do have to connect with them. Like, you got to have a good relationship with them. And then use Quizlet. Quizlet's a great tool. And we would divide up chapters. So I would take 1 and 2, somebody else would take 3 and 4, or whatever it was. And then you take your questions, you put it into a group Quizlet. Everybody has access to it. Music Junkie, I would stay away from the study groups. It depends. It really depends. Like, I had a really good study group who I'm still really good friends with. I've watched them go on to start families and grow in their careers, and they're kind of like my kids in a way. I was kind of like old enough to be their dad, but we also were friends, and they would be over at my house all the time because I was one of the older students. So we actually had a house to come to. We weren't studying in an apartment, a noisy apartment. They would come over here and would just like live here basically. Oh, Bobby just posted a highlight from my live. That's cool. I've never seen that before. I've never seen that notification. If you've ever posted a highlight from my live, thank you. That's pretty cool. Mr. Clean's still around. Test after I graduated, they lowered the passing grade from 80 to 78. So I was the first cohort at my nursing school that got a new grading scale. It used to be a 10-point scale. They moved it to like a 93 to 100 became an A. Had they left it where it was, I would have been like magna cum laude. I think I missed it by like 0.04. Gizmo, I've never heard of Gizmo. Is that like a Quizlet kind of competitor? Music Junkie, I made great friends in school, but couldn't study with them. I think some people are loners. Like, they do better when they study on their own. See, we actually were pretty diligent. And we had a couple that would kind of keep us on task. I was one of them. I was totally the dad. Ames is a proponent of Notebook IM. I have not been familiar with that. Never used that. Can even make your chapters in a podcast. Oh, that's cool. That is really cool. Bobby with the club cheers. Thank you so much. So it is kind of like a Quizlet, but you and your friends can compete. Oh, ooh, a little competitive nature in there. I like it. Music Junkie, I tried. It didn't work. You tried the group. You gave it, A for effort. Do I need to advance study like the ANAFI? I don't know what that is. Have you ever forgotten about a patient before? I would say I've forgotten about a patient. There have been times, especially in an ER, where like a trauma comes in or there's a code in the ER and you've got to attend to that first, and you come back and they feel like you've forgotten about them. But we take care of the sickest people first. And the winner got a Starbucks card. Oh, that's pretty cool. Oh, it's LM, Notebook LM. They love them, and it takes 3 minutes to create. Oh, I'm gonna have to check that out. Not that I'm going back to school, although I really should, because as a clinical instructor, I get free like classes. I could go back and get my master's for free. Oh, lots of people are singing the praises of Notebook LM. I'll have to look into that. Bobby says, read everything completely. Yes, I agree. But if you are behind and you need to catch up, I think the best the best thing to do is to read the headline, the headers of each section and the first sentence of each paragraph, and then go to the end of the chapter and read the summary. At least you will have some idea of what's going on. Aaron, thank you very much for the follow. I appreciate that. Ari says make podcasts and listen. That is really cool. Yes. Or like if you're like on the Stairmaster, like Jen does, Legal Nurse Leads on her Stairmaster in the mornings. Yes, Sophia, I'm a clinical instructor for a BSN program. Oh, Music Junkie, think I'm going to try and get into CRNA school. That's great. Go for it. It's a lot of work. Legal Nurse Leads, I haven't been clinical in almost 9 years, still have nightmares about forgetting a patient. Oh my gosh. So I will have bad dreams. I don't want to call it, because I have nightmares. And these are like bad dreams, stressful dreams, where I can't get things done. There's always something getting in my way that prevent me from getting to the patient care. And I head that way. I want to do the thing, and then something happens and I cannot get there. I keep having to address all of that. Eliath, have you ever seen a Glasgow smile? I have not. A Glasgow smile is a brutal form of physical mutilation or torture with a victim's face. Oh, yes. Yeah. There's an actor that has that. He's been in a lot of things. You know him because he's got the scars, right? He's got the scars. What is his name? Tommy Flanagan. He's been in a lot of movies. It's also known as a Chelsea grin. Yeah, Tommy Flanagan is a Scottish actor, and he was attacked earlier in his life, but he's got that. Yes, I didn't know that's what it was called, but I've never seen that I've never seen a patient come in having had that happen to them. No, I think that's what you were asking. Hospital. This is Hannah Tiller. Hospital let me go home with a resting heart rate of 138. Is that normal? The heart rate itself is not normal. It depends. Like if you're in AFib RVR, and they started you on a medication, but typically where I work, we would not usually let somebody go home with that heart rate. To the Google machine. Oh yeah, it's totally growing on me. Can't get too much of this positivity, right? Like we're digging this. All right, so the question is, I feel bad for the people that are listening on the other channels because they can't hear the music. You can only hear it on the TikTok live, right? That's where you got to go. And if you're ever thinking about going live on TikTok, you should just do it. When I started going live more than a year ago, there's like 2 people. But you just be consistent. Post, consistency, go live, ask the questions, answer the questions, learn. And then next thing you know, you'll have a whole like 58 people in here. Or if you join me later today, we'll have like 150 people in here. Let's see. What is the normal heart rate of a walking? Oh, so like when you're walking, it depends. So like my resting heart rate is like 55. When I'm sitting here doing nothing, 55. When I sleep, it drops down in the 40s. That's normal for me. I'm in pretty decent shape. I work out every day. And then when I walk, like if I'm just taking a leisurely walk, maybe it'll get up to like 80, 90. And even on a really brisk walk, I can rarely get it above like 109. Now, when I get on my Peloton bike over here to my left, it'll be like 170 because I'll do a hit and hills ride at HIIT, high intensity interval training. I'll do that in a hills ride. And yeah, my heart rate will go way up, but then it always comes back down. And that's probably why my resting heart rate's so low. As an instructor, can you please stress the importance of strokes and catching them early? Oh, absolutely. Yeah. So my students are very first semester of upper division nursing. This is the clinical that I do is their very first hospital clinical. So I absolutely love that. Oh, Melanie, thanks for the donut. Good as hell. Jen, thank you so much for this song recommendation. I didn't know I needed this in my life. Bobby, I have vasospastic angina. Very interesting. Heard of it. I've heard of, it's Prinzmetal, right? Isn't that what we used to call Prinzmetals? Spasms? It can mimic a heart attack. Like you can see EKG changes, have that chest pain. Yes, that's great. I wish nurses another part. Oh yeah, we literally have like laminated sheets that talk about the symptoms of a stroke. We are really good about our times on our stroke patients. We think we're really hitting our milestones, and our next project is doing better with our MIs, which I feel like we do a pretty good job of. I mean, if anybody says the word chest and pain, like within any proximity of each other, we're ruling it out. And we have a lot of nurse-driven order sets. So if we have somebody that comes in and we're like, this is a stroke alert, the nurses absolutely have the I guess, independence and autonomy to call that. We have Voceras, so we will activate our Vocera. So if I'm the triage nurse and somebody comes in and they're like, oh, he started slurring his speech like 30 minutes ago, I stop what I'm doing right then and there. Boom. I hit my Vocera and I say broadcast to code team. And then I'll say stroke alert ER, stroke alert ER. We have a stroke bed that's designated for stroke patients. We take them straight to that bed. It's already it's already been zeroed out. We can weigh them on that. And then once I do that, charge nurse is going to drop in all the orders. There's an order set for stroke workups. Drop it in, everything automatically populates, prints out. We call CT, but when the CT hears it overhead, they're clearing the table, or one of them. We've got 2 CT machines. They're going to clear it and get that patient back there. Often, a lot of times, they're ready for them before we even get them to the stroke bed. Right. So that is just to rule out hemorrhagic. So there are really 2 types of strokes. There's hemorrhagic and ischemic. We're ruling out hemorrhagic because if they're having a hemorrhagic stroke, that means TNK is off the table. We're not doing thrombolytics. Okay, that's why we do that, to rule out a hemorrhagic. Hemorrhagic is only about 13%. 87% are going to be ischemic strokes. But that's just standard stroke protocol. But they're still going to get a teleneuro consult. We do teleneurology consults. So there's an iPad that we put in front. We do the NIHSS assessment, and we do all the things. Swallow studies, we do all of that. Yeah, so if you work like in a smaller ER, I recommend having a designated stroke bed. Everything is there. You've got your cardiac monitor. You have a glucometer that's ready to roll. You have an IV start kit. You have everything that you need right there. And then we get that patient, we take them straight back to that bed. You can weigh them right then and there. And then when CT calls, you just literally take them in that bed. And then when they come back from CT, hopefully you have a room available. You can just drop them, you can take them to that room. Ames, I educate anyone with AFib about stroke. Yes. So the standard that I do is like when we have patients who are, especially patients that are not really good about taking their medications with AFib, one of the things I tell them is like, look, let's talk about AFib. What is AFib? It's where your right atrium is not fully contracting. And so it's not forcing that blood down into through the rest of the heart and through the circulatory system. So when blood sits in one place too long, what happens? And like they all pretty much know, oh, it's gonna clot. It's gonna clot. And then when your atrium gets a good contraction, or you come out of AFib and you go back into a regular rhythm, it's gonna squeeze that clot. It's gonna end up somewhere it shouldn't be. That is why it's so important that you take your anticoagulant, whether it's Xarelto, Apixaban, whatever that you're prescribed. That's right. Educate why the AFib causes strokes and how patients take that. Tell them the risk of not taking their medication. It could result in something far worse. Come to Moorhead City, North Carolina, and teach those folks at the hospital. I'm working on it. Maybe I'll send some nursing graduates your way. All right. we got 3 more minutes, and then I got to go get the kids ready for school. Solo parenting this morning. Wife had to go to work today in the office. The office has been having issues. Yesterday she went to work and the phones didn't work. Internet wasn't working. That's really hard to do your job when the phones and the internet didn't work. So she ended up coming home. But today everything's back up and running. Much rather have her work from home, right? Sarby. Sorry, one more thing from the patient and family side. Type 1 diabetes versus type 2 is important. Sure. Type 1 is, what used to be called like juvenile diabetes, but that is your pancreas is just not, it's not working. Type 2 is usually lifestyle as you get older. What's your wife do? My wife is a CPA, and she works for the federal government. I'll let you do the rest. 3 letters. Best way to get rid of intense migraines? The best way is to manage them before they happen. So that would include working with your primary and maybe a neurologist to figure out what triggers them and try to minimize that, and then have treatment plan in place for when they do come on. But there's lots of things that can cause them. Stress can cause them. Not taking your medications can cause them. Music junkie. My brother works for a 3-letter government entity too. Yeah, my sister-in-law works for like one of the scary ones. Like, has always been scary, not like just recently been scary. Like the kind that you don't ask questions. Is baby aspirin a day helpful for blood flow? So Rebecca, so there was a time then that was like a thing, like, just, baby aspirin a day. They have changed that. They changed that many years ago. So they no longer recommend that unless your doctor specifically tells you should be on it. They found that there's slightly more harm than good from that. So no, you should not, unless your doctor has told you to do that, then that's probably not something that would benefit you. Music Jam, my brother's director scares me. Like I don't want to know, like any of the people that my sister-in-law works with. I don't want to know them. I don't ever want to see them. I know I've been in, because the nature of her work, I know I've been investigated. 100% I have been. I mean, I've had a federal background check. Yeah, I know who you're talking about. And I'm telling you, like the ones that, like the people that she works with, I don't know. Nope. I don't want to be on anyone's radar with the people she works with. No, thank you. Nursing the T, yes. For migraines, some people do really well with the Botox, which will probably get in trouble. But that's okay because we're almost done. It's like every 12 weeks. I think it's pretty expensive. I don't know if insurance covers it, but it's like 30 something, like around the face and the head. But from what I understand, the people, I know Amanda Donnell, who is a regular in here, I think she's at work today, but she was in here earlier. She's talked about that. She's had posts about that where it's really helped her migraine. So I'm not even allowed to know where my brother works. Also a scare. Yes. So like there was a time that we were told like my sister-in-law was gone like for like a year. She said she was in Poland. She was not in Poland. She was near Poland, and you can figure out where she ended up. I'm not saying a word. Insurance does cover it. I guess it would depend, but yeah, that's great. If it does, 33? Whew, that's a lot. I bet it's got to be worth it, right? It's got to be so worth it to do that many. Oh, there you go. So it looks like insurance is probably a good option to have that done. I'd imagine you have to go through like your primary or maybe even like a neurologist if you, I don't know. Insurance is weird. Depends on who you have. They may be like, oh, no, you need to try these before you can do that. So, all right, before we get off, got to show off the hat one more time. There we go. All right, folks, it's time for me to get out of here. We're going to do a bonus live today at some point. So if you're around and you have time, you want to stop in, love it. If you're working today, have a great day at work. And we will, at the very least, we will be back here tomorrow morning at 6:30. Sophia, have a wonderful day. Thank you all for stopping in. It was another solid live. Ames, thanks for moderating. Holly, thanks for moderating. And thanks to everybody for stopping in. We will see you later today or tomorrow morning. As always, be kind to yourself, be kind to others, prioritize your mental health. I'm Gary, the ER nurse, and we'll see you next time. And for those of you still here on Substack, Instagram, where else we got you? YouTube, Facebook, maybe. Thank you all for stopping in. We will see you later this afternoon, only on TikTok, and then tomorrow morning we'll be back here as well. So appreciate you all stopping in. You all have a wonderful day, and we'll talk to you next time.